of Your Health with Corinne Furnari, clinical nutritionist and physician assistant, and my co-host, Carol Petersen, pharmacist. Every week, we present you with new and creative ways to help you make sense of health information and bring it home to you and your family. With years of clinical experience between us and research into traditional and cutting-edge technologies, we give you practical information to help you take charge of your health. Welcome back. Welcome back. I'm Corinne Furnari with my co-host,
Carol Petersen.
My goodness, we have a first. Nobody's silent at this time. We're both able to speak. How wonderful. We're getting the technology down. I'm so proud of us. So today we have a unique show. We decided since we are reaching out, we're reaching out to a larger community, but also since we moved multiple times in the time slot, what happens is that many of you know us. Well, we've been doing this show for 23 years. So you know us, but you don't know us. So what we decided to do was to introduce ourselves to our current audience, but also introduce ourselves to a possibly new audience. So they understand who's talking, why we're talking, etc., etc. So with that, I want to say hello. And Carol, do you want to start?
Oh, goodness.
Oh, goodness.
Well,
I threw it right at you.
Way back when you were a kid, did you play doctor?
No, never.
I did.
Uh-huh.
So I got a degree in pharmacy at the University of Wisconsin. And it probably occurred mainly because I went to a career night when I was in high school. I was very interested in sciences, and I might have leaned into chemistry, but I learned that even after you got a PhD in chemistry, there might not be any jobs. And so I happened to pop into one on pharmacy, and there's quite a lot of things that you can do with a pharmacy degree. And I stand here today really making that thing very, very true. I've done something that's far away from the original concepts of being in a pharmacy. I grew up in a small town in Wisconsin, and we had a corner drugstore. And what happened was I went ahead and did the pre-pharmacy, got into pharmacy school. And then at that time, we had to intern for a whole year, but you could split it up in summers and then half a year after you graduate. So I went to that corner drugstore and got this pharmacist who is now 82 to get back into the preceptor program so I could work at his pharmacy. This is after I completed a whole year, and I thought, I better get some practical experience. I've never, ever worked in a pharmacy. I don't know what's going on. So it was extremely helpful. And I interned also in a hospital. And I did, after that point, after I graduated, I went to Texas, where I worked at the very famous Dallas County Hospital, where John Kennedy was taken after he was shot. But it was very inconvenient. It was an hour each way. So I ended up working in a retail pharmacy, and which has been most of the time until I started with Women's International Pharmacy. But I really liked working with people face to face, directly answering questions. And I remember I had Earl Mendel's Vitamin Bible.
Oh, yes. I remember that?
My
first
copy.
real current book.
Yes.
Scientific.
Yeah, at one time, I picked up the phone and I called Earl Mendel. He actually, I think he was from Santa Barbara, and he taught in the pharmacy school there. And he was quite astonished to speak to me because he said, I go into pharmacies, and he said, no, I see racks of books, and they're not that far from the pharmacy. And I could ask whatever pharmacist is there on duty, and I find out that they've never looked at
Never
my
read
book.
it. No,
No. So
that's
that was
curiosity in action.
so that was early leaning. So why don't you tell us about some of your early start?
Okie dokie. Not. I will begin when I was at San Francisco State, and I really wasn't happy. I was in a sociology major. I wasn't happy or comfortable with it. Different things were happening, the free speech movement. And then what happened was I became a medic where kids were getting hurt, people were getting hurt. And I, with a group of people, started working with them and helping them and assisting them as need be. Uh, and then, and I really liked it. I liked the urgency. And I was very involved in the free speech movement. And I was looking at powers and power struggles. And I said, where is the greatest power? The greatest power is with mothers. And when a mother has a knowledge or an understanding of her personal power, that's passed down to the children, to the entire family unit, and even to the community. So I said, well, how do I go about teaching or working with women to be aware and of their power? And I said, I want to become a midwife. And because that's the most people, knowledge can be like a clamshell, or awareness can be like a clamshell. It can be closed, 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 closed. And then a moment in life happens, often with trauma. It doesn't have to be negative trauma, it could be positive trauma, but it's an extreme emotion, and the clamshell opens. And people are then more willing to take up new knowledge or new understandings, and who more than a brand new mother is more open to the protection of her family, the understanding of her power as a mother. So I went about looking for a midwife program. They didn't exist in the States. They didn't. Only in Virginia. Now, I was in California. Only in Virginia was a midwife program. There wasn't even a nurse midwife program. Later on, Yale started a nurse midwife program, but that didn't exist at the time I was looking. So I started looking into England, which has a very famous midwife program that works with midwives, not nurse midwives, and I'll explain the difference. And then I started looking at Canada, and Canada had a brand new program that was, it's experimental, teaching women to become what they called lay midwives. The difference between, and the reason why it was so important to me, the the midwife program based on the British midwife program, and a nurse midwife program. Nurses are taught to be in a hierarchy of medical, where they don't take responsibility. Once the responsibility or the problem becomes very great, or what they call the doctor, and right down to their books. You'd go page after page, and you notice this, you notice that, you notice this, you notice that. And what happens? Turn the page. Okay, now what do I do? Call the doctor. That's what the book has. Whereas midwives are used to and trained to take responsibility, to take responsibility for the lives in front of them, to take responsibility and to know their limits. So they understand that they need assistance and have backup set up, and all of that is set up and prepared. So I went to Canada and worked in that program delivering babies. I went to then when I was completed with that program, I went to Central America. I went to Guatemala and Mexico and delivered babies. Then I came back to the States. There was nowhere for me to work. There were no programs for me to join. There was nowhere for me to work. So I said, now what do I do? And I heard of a brand new program that was beginning, very, very good program, um, a PA program at the University of Southern California. I applied, and my goodness, I was accepted.
That's
And
physician
I
assistant for
spent 2
PA.
years plus in the University of California, and I graduated right up there with honors, very excited. And my whole intention was to become acting midwife. But in actuality, what I had been taught was a very broad range of medicine. So I was curious. I wanted more than just midwifery. And so that's what I got. I was licensed in California in 86, and I came to New York in 89. And from 89 to present, I've been a licensed physician assistant. I also um, I also became a certified nutrition specialist in the state of New York. I was and a certified um, dietary um, uh, certification in the state of New York. So after that, I continued working, and I'll just go quickly. Taking course after course after course, as you do and have been. And I took many nutrition courses, and I was studying IV nutrition therapies and their benefits. But I also started taking courses in ozone therapy. I became one of the originators of the a certified. I was certified for the American Academy of Ozone Therapy, and I was one of the creators of the society. And I also was became a member of the it's called Cosmo Gynecology. So studied aesthetics as it relates mostly to women, and multiple courses there. And then I worked in holistic medicine from then to now, and really have had a great time. When did you become the renegade pharmacist?
It's a good question. So I went to pharmacy school and then I
Carol?
did.
Carol,
Yes.
something happened. I can't hear you. I'm sorry.
Oh no. Let me just
Whoops.
check.
What happened?
Can you hear me?
You could be
Can
heard
you hear
fine
me?
over here. There may be something with your
Okay, so
connection,
I'll
Corinne.
continue.
I
Well,
I'll
can
I'll
you hear
I'll
me?
I'll go on. I can hear you, Corinne. Can you hear me?
Carol, I can't hear you.
Yeah,
So
why don't you continue on,
what
Carol?
happened
I'll
was
go
Save you
ahead.
time.
I'll
we
go
um,
ahead,
Something
Corinne.
on Corinne's end.
um,
Okay.
we
Reggie, tell
decided
her,
to
please. She
talk
can't hear
about.
me. I don't want to talk over her.
No, no, go on, continue. I'm texting her right now.
Okay. Okay, thank you. So I started graduate school at the University of Wisconsin. I was accepted, and I thought I would like to study pharmaceutics. And pharmaceutics, we have a lot of pharma words like pharmacokinetics was a big deal back then. And this was a study of what happens in your body when you take a drug, where it goes, what does it do, how do you eliminate it, how long does it take. There's quite a lot of stuff you could study here. And I was thinking about working with a professor, Dr. Joe Robinson, who was particularly working with skin and eyes. But as it turned out, I decided graduate school really wasn't for me. Ironically, Dr. Robinson went on to create a vaginal lubricant called Replens, and then he incorporated progesterone into that Replens, and it's designed to stick to your vaginal walls. And he put progesterone in it and became the FDA-approved drug Crinone, which I think it has 40 and 80 milligrams of progesterone in it. So after the graduate school, I did move to Texas, as I mentioned before, and it was kind of an evolution in my whole pharmacy situation, and went back to Wisconsin after a time, and I became quite disillusioned, actually, and I thought maybe I should quit and do something else. But then I decided, well, if I don't quit, I'm going to be the best pharmacist I can be, which brought me into quite a lot of pharmacy politics. I became very active in the state association. I reignited a local and group, and we'd have speakers and things. And it's all very good, but not quite the thing. And ultimately, I went to work at a clinic that was owned by 200 doctors. And I got the job as a head pharmacist at the biggest clinic. And I was horrified, really. So I was used to working at pharmacy, slower pace, getting to know people very, very well. And now we had about maybe 30 to 90 seconds to speak to anybody. And so it was like this medicine was practiced on like a factory. People didn't have opportunities to be listened to be heard. I had one gentleman, he's dying of cancer in front of my eyes, and I broke ranks and talked to him a little bit just to have some human contact with all the horrible treatments he's going through. So I found this atmosphere really, really depressing. And I decided maybe I should get my own place. So I actually was looking at buying a pharmacy in a small town. It was very sweet. It's New Glarus, Wisconsin. And it has like a Swiss theme. And so to this pharmacy, had lots of gifts. I thought it needed a lunch counter because that's part of community too. And about that time, Wally Simons called me and asked if I would like to work at his pharmacy. It was Women's International Pharmacy. And I knew Wally quite well. He was in my neighborhood. I was working retail at a Kmart pharmacy for a while, and he would come and chit-chat with me. He loved shopping in there, and he'd always bring me up to date. And he was telling me about what he was going to be doing with progesterone for the treatment of PMS. And I go, this is what I said to him. I don't know if I could talk to women with PMS all day long. But famous last words. When I actually went to go talk to him and make that decision to go work there, he He, of course, remembered my earlier statement and threw it back at me. But I found when I went to work there, it was like every single thing in my whole life contributed to what I could be doing at Women's International Pharmacy. It seemed like everything was just coming smack into what I needed. And as it turned out, it wasn't just PMS. It was very progesterone centric, and progesterone is so important all the way through the lifetime of women and men that even though I've learned a lot about other hormones too, I consider progesterone so pivotal that it always needs to be looked at and considered. Corinne?
So I moved to New York, as I stated, in around 89. And I began working at a holistic doctor's office, which was really quite good. And we were very busy. This was something very unusual. New Yorkers were a little behind in holistic health at that time. And it was interesting. I would say take vitamin C or something simple like that, and people would say, oh, I couldn't do that unless my doctor told me. What is vitamin C for? Is it any good? And here we were, really, we were quite advanced, and people would seek us out from all over, but yet the general public was not really well informed. So, but I continued working in holistic health, and then Bernard White became one of my patients, who was the program manager at WBAI in New York. And one day, this study, the women's study, came out with this big expose that the study had been stopped due to the danger to women in terms of cancer and heart disease and heart problems. Well, I looked at the study, and what did I see? First of all, these were all synthetic hormones. They were Premarin, which is horse mare urine, with more than one type of estrogen, and one that our body couldn't break down because it was a horse urine, a horse estrogen. And then it was combined with a progestin, which wasn't even progesterone. So they were saying that hormones were dangerous because of this study. Well, I became quite irate, and I contacted Bernard. And I said, Bernard, I need to be on the radio. I have to tell people that this is totally incorrect. I would hear the head gynecologist at Harvard talking about progestins and progesterone. He never said progestins. He was confusing progestins and progesterone. When I knew progesterone was very supportive of, at that time, I felt the female physiology, their brain, their body, their mood, and very beneficial. But even the head gynecologist at Harvard Medical was not talking about the difference. There were multiple studies at that time on the benefits of estrogen, the benefits of progesterone. And they were like 42,000 people in Europe. I don't remember the name of the study. And then studies out of Europe also on progesterone. And yet nobody was talking about that. So I got on the radio and started talking about that. And people would call up and they'd be crying, now what do I do? My doctor took me off my hormones and I can't sleep and I'm sweating and I'm nervous and my libido's gone and I'm vaginally dry. What do I do? And I'd say, well, we could use these natural hormones. No, I won't touch hormones. I won't go near them. Women were screaming at me, literally. Not me personally, but the situation, because they felt so deserted and they even felt betrayed. And that was very, very, very frustrating. So I was on the radio and I would talk about hormones multiple times on the radio. And then they asked me to start a program. And I go, oops, now what do I talk about? Because it's a much, and the show began, and we'd take different subjects. We'd take hormones. I introduced on the radio CoQ10. Nobody had ever heard of it. Dr. Steven Sinatra was talking about CoQ10. He semi introduced it to the public, and people were going, CoQ what? CoQ what? I also on the radio introduced Dr. Jacob Teitelbaum, who was the first person to ever put together a study on healing or supporting in chronic fatigue disease, which at that time, chronic fatigue disease was like a sentence, because once you get it, there was nothing you could do about it. They'd give you salt tablets and low-dose hydrocortisone, and that's all they'd give you. But Dr. Teitelbaum came on the radio show multiple times, trying to calm people down, focusing them to what they can do to heal their bodies so they could get back in the game. And fortunately, I felt very, very fortunate that I was a part of sharing that information. See, Take Charge of Your Health it's a radio show, but we have a mandate, and that mandate is to share information, to talk up to people, and allow people to take something with them that will assist in their health, their family's health, and that they can do on their own. Also, to teach people to become a participant in their own health care, to direct them to their personal power. You can't have power if you don't have any understanding. When medical people start talking to you in all those terms, and this has to be, and that has to be, and this and that and that and this was before the internet was available to the average person. You were pushed into fear, and you get overwhelmed. Oh yes, anything you say. You don't have the ability to make choices. And what this show, the intention of this show, was to educate people, to talk up to people and educate them so that they became full participants in their personal and family health care. And it's very similar to what I was trying to do as a midwife. It's full circle, and this has continued for the last 23 years. I met Carol through hormones. She was at the Women's International Pharmacy, and I'd call her. And here I was one of those wacky people. I'd say, well, I have a woman who's an opera singer, and her voice is changing because she's going into menopause. She's losing her estrogen. Could you make me up a small little lozenge that she sucks on so she's not in a high amount of estrogen, but a topical amount of estrogen for her throat so it doesn't stiffen. And she took that and she went to her voice doctor, and he said, I don't know what you did, but everything has changed here. And she could hear it in her voice and her way of. So Carol and I became very innovative in how we presented hormones. And that's the strength of bioidentical hormones. They are individualized for the patient who comes to sit in front of you. It's a really powerful form of medical treatment. Carol?
Yeah, it really is. One of the blessings, there's been several blessings in my association with Women's International Pharmacy, was eventually I did every job in that place except for compounding. Maybe I made up one or two things myself. We had division of labor just after I started. One pharmacist said she preferred to be in the lab and off the phone, and I said, good, I'll take the phone. Anyway, so with Women's International, I had this rich opportunity to travel to many medical conferences representing Women's International Pharmacy, and some of the many heroes in alternative medicine I got to meet. I got to hear what they had to say. It's an education beyond belief. And then one day, I'm sitting at my desk at Women's International Pharmacy, and the phone rings. And it's this doctor who has a very nice voice. And he said, what did he say? Neuropsychiatry, I can't remember the word, but it's basically attaching the brain to the rest of the body and studying how the hormones flow that way. So I was so astonished to hear that. And then he continued to call, and ultimately I went to meet him and I married him, and I continued to work with Women's International Pharmacy and going to a lot of conferences, but he and I were also conference junkies, I have to say. So even on top of my work-related ones, I got to go to so many other conferences, actually a lot of international conferences. And so on top of all this beautiful experience in the U.S., I got to expand beyond those borders and really, have your eyes wide open to all the potential stuff. And it's still happening. Never a week goes by that I don't learn something from somebody, whether it's online conferences, a book I pick up, or with clients come to tell me about what's going on with them. It's been such a tremendous learning experience. And then Corinne, we used to be telephone buddies for a long time before we actually did manage to go to the same conference together.
And we went to Europe together.
Yep. We had some great times together. And then Corinne invited me to talk on one of the shows. And I did, and it came to pass that you had somebody that was a co-host with you that was no longer a co-host. And so I was really thrilled when you asked me if I would be interested in co-hosting with you. And I have to say, it's been such a wonderful journey. When we do a radio program, you'll notice we go back and forth quite a bit, and it seems like we complement each other so well that it's easy. I never worry that we're going to run out of stuff. I know Corinne is there and she's solid and she can do a radio show solo. I'm not so sure about me, but nonetheless, it's been quite the journey together, and it's been just beautiful. We bring on other speakers to enrich ourselves and to enrich our audience. And there's nothing better than to hear from we take call-ins, and it's wonderful when somebody calls in and said, I learned this from you on the radio, and it made a big difference. And I think that kind of reward is far better than money. You feel like you've fulfilled your purpose while you're in this world. Corinne?
I agree with that totally, but I wanted to switch a little bit. And, well, I'm going to say one thing. I learned so much from my patients. That I learn from what they have experienced. I learn from what they have tried and worked and didn't work. I learned so much. And I learned from this radio show, you know, before we go on the radio every week, we decide a topic, and then not only do we have our knowledge for years in practice, over 30 years in practice, but we also, I study and do research on current. So every week I'm learning and refreshing on all different topics. But I wanted to talk, I wanted to talk about, do you mind that we talk about our personal histories on using bioidentical hormones and why we started them?
Sure. I'll start. So at Women's International, and that was very, very nice. So when I started, I had about a week to go through the file cabinets. Wally had piles of literature he collected, so I had the opportunity to really look things over, ask questions. And it's a specialty. You know, you don't get trained for this in medical school, pharmacy school, nursing. They don't really do a deep dive into hormones as we were doing.
Many people say they do bioidentical hormones, but they really don't understand the finesse of them. Go on, Carol.
So I'm reading about progesterone and its effect on the skin and the structure of the skin. And this article is talking about these little lines, crow's feet by your eyes. Vanity. It's totally vanity that got me started. And I thought, okay, I'll get some progesterone cream, and I'm going to apply it there and see what happens. Well, it wasn't as phenomenal as I anticipated, but what did happen that was actually miraculous was in about 4 months, I had one breast completely cleared and the other was almost cleared of fibrocystic breast disease. And ever since, I've always used progesterone since, and no problems. I did have one lump that was the largest at the 4-month period time. It had shrunk considerably, but was still there. I had a phone call one day with Dr. Eugene Shippen. He's been in the hormone world and wrote a very nice book about testosterone. He said to me, I don't know why I was telling him about my breasts, but
Wow.
how we got there, I don't know. But he said, we get rid of cauliflower breasts all the time, iodine and progesterone. And so I used iodine too, and sure enough, that was the end of that problem. One time I did a podcast, and I thought this was kind of interesting because I sort of fell into this, and it really was important to me. I've got a hypopituitary. My pituitary doesn't put out the hormones as well, and I think in retrospect, I think I was poisoned by atrazine in my hometown, which grows a lot of potatoes, and so this lowered pituitary function, and you can do all kinds of tests and imaging and see if you have like atrophy of your pituitary, but I didn't want to have MRIs. I just decided I would treat myself as I could by supplementing the hormones that weren't as robust because my pituitary. And as it turned out, it's worked very, very well. And I'm still doing it, but it's because I had this personal issue, it's helped me explore all the hormones that you might need from low pituitary function. So I did a podcast with somebody not too long ago, and she asked me about my hormone journey, expecting to hear a lot of gruesome details and problems with menopause. And I said, well, it was pretty much a nothing burger for me because I already knew what to do. So a lot of times people have these health issues that forces them to seek out alternatives and have this really kind of difficult journey. And through this whole menopause transition, really not too much trouble. I had 2 cycles only that I had exceptionally large flow. And I go, oh, I know what to do with that. My progesterone's been a little low. I may have had extra stress. Disappeared. And if you think about it, it was so easy to fix. But it is the number one reason for women to have hysterectomy in the U.S. is excessive bleeding during the menopause transition. Corinne, how about you?
My experience and exposure, my first exposure with hormone therapies was in college. That's when the birth control pill came out. So I went on the first birth control pill that was ever put out. And here I was, this slim girl in college, and I gained 40 pounds in 2 months.
Oh, my.
I felt horrible. I said, I didn't even know what was happening to me. I went off of it, and I was able, with a little time and a lot of work, to lose it. But I felt so horrible on that pill. I said, never again. I'll never do that. So years went by, and then the women's health study came about. Oh, and my population was getting older, so they would ask me to prescribe hormones. And I said, no, I'm sorry, I don't do that, because I refuse to prescribe the horse urine, the estradiol horse urine, and the Premarin, because I knew I had gotten so sick on it and I couldn't control it. Well, then I heard about this doctor in California, Dr. John Lee. So I flew to California to take courses from him on hormone management, particularly directed toward progesterone. And so I started working with progesterone on myself and with patients. Then the next thing we heard about was DHEA. And I started working with DHEA. So I went into this one step at a time, like walking into ice water. And then one day my mother was in her mid-60s and was talking to me. Now, my mother's one of the smartest people I ever met. And she was talking, and she was taking a half an hour to get through a sentence, just rambling and rambling and rambling. I said to called my sister, I said, what's happening with Mom? I've never heard her like this. She said, well, I don't know. I've heard it also. And so I started my mom on hormones. I started her on progesterone, low dose, very low dose estrogen. And then I added DHEA. And I also started her on a low dose thyroid, at that time Armour thyroid. She was herself again, feeling great, bright, and alert and feeling great. It was amazing. So then as time went on, I added testosterone, and her doctors, now she was, it's been years because piece by piece by piece, her doctors would take a blood test on her and they say, oh my God, I wish my 23-year-olds had blood tests like that. They'd also do a DEXA scan on her bones. Her bones were fabulous. And so my mother would be, well, my daughter's treating me. She's got me on estrogen, progesterone, DHEA, pregnenolone. She's got me on testosterone, and I feel great. And they would all say, oh, you don't need any of that. You should get off of it. And my mother would say, oh, okay, anything you say, and walk out the door and say, no way. No way will I stop that. She lived to be 100 plus, and she was on her hormones all the way through. She fell a few times. She never, ever broke a bone. And she was terrific. And she is the perfect example of what natural hormones can do. I have another, I really don't talk about myself very much. I purposely avoid talking about myself on the radio. But I had a very serious accident. And very serious. And what happened was, in that process, I was in the hospital for 7 months. But we still did the radio show because it was me and Carol. So they would lift me up and put me into a wheelchair, and I would roll myself into a utility closet, and I would do the radio show. But there were times when I could not retrieve words. And so Carol would very politely interrupt me and keep the conversation going. So people really weren't aware of the problems that I was having. But when I started the hormones back again, because everything stopped when I had the accident. So it took me about 8 months, 9 months, maybe 10 months to start up the hormones again. Here I thought, well, I've lost it. I'm not going to be able to mentally remember or maintain my words. When I started hormones again, within a month, I called Carol. I said, Carol, something has happened. She said, why? What's wrong? Are you okay? I said, my words are back. My brain is back. I feel a difference. And from that point on, we've continued, and it's pretty amazing. Now, we have studies here. I told you, every week we look things up. And we have studies here. I've got one right in front of me that shows that progesterone is essential in memory. And I'm just going to read this. It showed, and they did an MRI, and they documented this with an functional MRI, functional neurologic MRI. It's a new kind of testing, imaging MRI. So it said it showed increased activation in the right hippocampus. It showed that the brain's primary hub for memory, it's the brain's primary hub for memory, and the left prefrontal cortex, which governs executive function. And these weren't just abstract biological changes. They were translated into measurable improvements in verbal working memory scores. And guess what? I experienced them. But then when you look at the study, they did the same test with progestins. And what they found was a sclerosing in the hippocampus. the total opposite effects. So progestins aggravate memory, while progesterone enhances it. What do you
Yeah,
think about that, Carol, about your favorite hormone?
these drugs shouldn't be on the market even. But I wanted to say one day somebody called on the phone when I was at Women's, and she was writing, she was a writer, she was writing an article for somebody, and she said to me, what is the number one issue that you hear from women when you're talking to women that call over there? And I said, they're afraid of losing their mind. And she said, no, you're wrong. It's breast cancer. I said, oh no. You have to sit in my chair and talk to many, many women was the other big advantage. When I was at Women's, hundreds and hundreds and hundreds of women I've talked to over the years. And that really is probably one of the most important things that women do realize that they need some help with. And it's just remarkable how the bioidentical hormones, they are neurosteroids. And that means they're active in the brain. In fact, your brain has a lot of cholesterol and it can make its own hormones given the right conditions. And if you're faltering, the real magic here is that when you give those hormones back, no matter what compartment, whether it's your brain or the mast cells or the Schwann cells for your nervous system, or it's the endometrium, or it's your breasts or whatever, your body happily takes up those hormones that you supplied with creams and capsules and gels and suppositories and lozenges and injectables and whatnot. When it's bioidentical, you get the result that could be predicted by knowing the function of that hormone on your body. And we have tons of research, tons of basic research that predicts all this, and it really does work. It's quite phenomenal.
We're getting close to the end, but there's a couple of things I want to say. Why women seek out bioidentical hormones. I looked it up. They have a fear over the safety of conventional hormones. Many of them felt betrayed by the medical community, that they didn't get the correct information. They have a distrust in the medical system, which is a little heartbreaking, an aversion to unnatural ingredients, a strong dislike for conventional estrogens derived from mare's urine and conjugated estrogens, and people state that as common. And why do they seek this out? That's perceived as natural and safe due to its plant origin and its bioidentical nature. They have a desire for individualized treatments, like we were talking about, which Carol and I, when we were talking on the phone and didn't even know each other, and enhance clinical experience with bioidentical doctors. So we are at the end of our show. Carol, give us your website. Now, we are going to continue this conversation. We'll on YouTube. So switch over to the YouTube page. You can text us questions and we'll answer them. Carol, your website.
My website is thewellnessbydesignproject.com. I have a YouTube channel with the same name. We have the YouTube channel we're referring to is Take Charge of Your Health Radio on the YouTube channel, where we are right now, visually as well as auditorily. And what else, Corine, your website?
Mine is Corine Health. We have newsletters, we have blogs, all available to you for free on multiple subjects, not only just hormones. And that's Corine, Corine, Health, and I also have a YouTube page, and we also have a Facebook page. Take Charge of Your Health with Corine and Carol. And we've set up a page on progesterone for men, a Facebook page. Come join us. It's very interesting. And I want to thank you so much for sharing this time with us. I hope you know us better now
Yeah.
and you understand why we're here. It's a lot of love. It's love for our audience. It's appreciation of this wonderful radio show. And I appreciate Reggie and all the work he does to keep us going. And Jeremy's our guy. He's the one that's helping us pull all this through. So thank
He's
you very
helping
much,
us be
Reggie.
more social.
Be more social. And we'll be back next week.
Okay,
Bye
bye.
bye.
Can you tell anything? I got off of.
Okay, I do believe we're on YouTube now. So if anybody has questions, you can type them in. Ask us questions. Ask us about our experience or share your experience so that other people can understand what you've gone through in finding or seeking hormonal balance. You know, it's interesting because I see multiple doctors, Schallenberger, Teitelbaum, Sinatra, when multiple doctors, every single one we talk about. Some talk about autoimmune, some talk about immune, some talk about cancer. And guess what? The base, one of the bases for getting people healthy has to do with the fact that their hormones get balanced. If you hear lectures by Schallenberger, he's got a list. Right at the top of that list is hormones and balancing hormones.
Oops.
So Carol,
Oh,
hello. So here we are. We'll continue. We'll wait a little bit. We'll continue speaking. There was another study I wanted to share, but didn't really have.
well, you're going to get a little reverb because I opened up YouTube. So I think I got to go off. Now you can hear me, but
I can hear you perfectly.
yeah, I can't, unless you open up YouTube, you can't see if you get any questions. So,
Oh, okay.
okay.
Not aware of
So
that. So the
we
word,
we we
word
may have to move from Zoom to YouTube, I'm thinking.
well, Carol, if you see a question, why don't you read it?
There's no questions right now.
Okay. So, uh, just mute the YouTube video and it'll be okay. You've got one question waiting.
Oh, Jeremy said that? I didn't see it.
Text it to us, please, Jeremy. And there was another study I wanted to bring up, and this one was by okay, from what I understand, oral progesterone isn't the best mode of adding progesterone. Carol, they're asking about oral progesterone. What they say is what they understand is that it's not the best. Did you hear me? Okay.
Can you hear me now? Can you hear me?
Perfectly.
Okay. Oral progesterone is just great, actually. But there are sometimes, if you have a disturbed gut, it might not be the best form for you. I wanted to just mention that working with women with severe PMS, as we started out with Women's International, starting dose of oral progesterone was 100 milligrams 4 times a day. Increased from there. Some women were taking spectacular amounts of progesterone before they saw relief. And I'm talking about thousands of milligrams of progesterone, and usually not all oral, like multiple kinds, but the oral progesterone worked like a charm. It tends to be very much underdosed because of the Endocrine Society, the Menopausal Society. They say, oh, well, we have data that 200 milligrams of progesterone will protect the uterus. So unfortunately, that has become a ceiling for a lot of practitioners. Like you don't need more than that. And I would propose that for some women, that's not going to be enough to protect the endometrium. I don't think studies have been done on a large enough samples of people to say that. Anyway, I like progesterone in any way, shape, or form you can get it.
And that's the advantage of bioidentical hormones. There are multiple ways, shapes, and forms that you can get it. The one that suits you best is the one that's right for you. And sometimes you might want to try a couple of different forms and see what works for you. I'm going to go finish this. Progesterone treatment was associated with greater activation in the left prefrontal cortex, the right hippocampus compared to placebo. The results point to potential cognitive benefits of estrogen and progesterone.
Progesterone.
Hello. But then there's more. A Dr. Thompson did a study about the push away from traditional hormones. And what he found was the neurobiological data suggests this isn't just a preference for the natural, it's a biological imperative. Hello? Emergent, in short, synthetic hormones don't just feel unnatural, they may actively work against your brain's recovery by antagonizing the very systems that they're trying to support. Emerging evidence suggests that cognitive events are influenced by specific hormone formulations, and that progesterone is more likely to be associated with positive outcomes than synthetic progestins. So we have a study.
Okay. All right. I'm going to jump.
Okay. Thank you so much. Thanks
Bye.
for sticking here with us. And you'll know next week we'll be here for a few minutes. We'll answer your questions. And I look forward to hearing from you. I'm Corinne Furnari, and I'm with my co-host.
Carol Petersen.
And we'll talk to you next week. Bye-bye.
Bye.